Hi, this is Dr. Senegal Phoenix. Uh, what we're going to talk about today is dyslexia and other symptoms, TMJ. TMJ is transmandibular junction. Big word, isn't it? Oh, yes, it is a big word. Oh, it causes you big problems. Transmandibular junction is actually this here up in your jaw, and if you take your fingers, you can feel it, and there is a junction right there. There's nothing in it. You can feel it. There's not a bone or anything. Just a junction. Nothing is in it, and that's your transmandibular junction. Okay. Uh, and if there's problems with that, if it's out of line, it's going to cause you big problems. Okay. Uh, and my dentist told me that mine is out of line. It's like this. The bottom is longer than the top, which if it was normal, it would be like this. And that's why I have problems with speaking, words, difficulty with speech, and also sometimes too, it would just shut like that, sort of like a alligator, and just shut and get stuck and can't open it. Has happened to me several times, and at that time I have to just relax and take like massage here, and that will help to release it, because then those muscles will become relaxed, and then I can open my mouth. Uh, and also too, she noticed that I have bites in the right side of my jaw, and that's from TMJ also. And I get headaches, real bad headaches, like up here, and then round here in the back, and that's where that muscle from the jaw is. So that's why I get it around here and around the back, because of that muscle. And uh, she told me to put wet heat on it, and that will help the pain. And then to just massage my temples when I'm having those headaches. So I will do that also. And she is working on something to try to correct the problem, because if I still have the problem, it's not going to help it. So she's working on that problem, and it's about 2 or 3 steps or 4. Anyway, the specialist, the TMJ specialist, had called her and told her what was going on, that I did have TMJ, and that to help the pain, to get a night guard. So they have to get an impression and size it with me, before I can get it. So that will help with the bites and the problem with me sleeping when, and with the bites also too. So, and she's going to help with the jaws because she said there are missing teeth down here. And as long as there are missing teeth, that will still cause the speech problem and the problem with the TMJ. So she has to fix those down there. And then there's one up at the top, which is major. And so she's working on that one now to get that one in. And then I think she had said after that she will work on the night guard. And so it was like, I don't know, 4 or 5 steps to get my mouth straightened out. And then, which I knew, I have to learn to speak over again once I get those things done in my mouth. Uh, and I don't look forward to that, because, I've worked with that before, and it makes you feel really bad that you don't really know anything or whatever. But I understand what she's saying because for many years I talked one way because of the TMJ. Okay. And I don't know if that's genetic or not. I don't think it is. But what I was thinking is that back when I was born, it was just all, we were segregated. White hospital over here, black hospital over there. And a lot of times the white doctors would come to the black hospital to deliver children and stuff like that. And a lot of times when things like that the jaw would get out of line during the time that he's pulling the baby out or whatever. Whereas nowadays they would correct by putting a brace or something or night, mouth guard or something to straighten that out. Whereas back then they didn't consider that really important, and they wasn't going to waste their time because I think I've had it all my life. If I remember correctly, I did. So that's why when I was young, I could not speak or have difficulty speaking. And that's why my sisters picked at me because I couldn't pronounce some words, and that made me go inside myself and not practice words. And that was wrong because I should have been practicing the words and maybe got my sisters to help me with the words, but I was ashamed. Uh, so now I'm finally getting some help. Yay! Uh, and I'm looking forward to that. And I probably will have to get a speech therapist. I'm not sure. Maybe they already have one, but I will have to learn all over again how to speak. So, what I'm looking forward to, getting everything's corrected and on the road to a better me. So, thank you, everybody, for joining me. And the tip for today is when someone tell you something, not say, well, it's not true. No, look into it, and if you need to. But if it's someone that you trust, take it at face value because it is happening. It's the truth. And the thought for today is that change comes every day. Embrace it. And I thank you so much for watching and have a blessed day and pass it on. Thank you.